This is crazy. This is crazy. This is crazy.
Today let's go over cases of medical malpractice in Howard County. And I think when people call us or when they think about medical malpractice, they often think medical malpractice is something that only occurs when a doctor makes a mistake or makes an error during the course of an operation. And that's just not true. Often some of the largest cases in the medical malpractice arena that we see or that we read about occur in instances of a doctor's misdiagnosis, often a failure to make a proper diagnosis or a failure to make a timely diagnosis. In fact, two recent cases in Howard County illustrate this point completely. The first is a case where a patient came in to a physician and cancer was not properly diagnosed. It wasn't properly diagnosed because the patient was a man. The cancer itself happened to be breast cancer. Breast cancer in men is curable if it's discovered timely. Perhaps because this is not a common occurrence, this Catonsville physician wasn't aware of the proper diagnosis or the proper test to take, but they weren't done. And what occurred in short shrift was basically a case where a patient would have been cured, nothing would have happened, and he would have lived on and lived a proper life with no issues whatsoever, and the opposite happened, and he passed away, and he died. Went to a jury. The jury was told of a couple things. One, obviously, the tests weren't done properly, misdiagnosis, but two, that this doctor, in fact, when they looked at his records, was probably seeing too many patients. Often physicians who see too many patients are too busy. They treat their practice more like a business and don't properly care for the patients. And as a result, this jury came back and awarded $4 million. Next case, mixed diagnosis, recent Maryland medical malpractice case, man in good health, strong family ties, suffered a blood clot in his lungs. He was in his hospital bed. Doctors didn't properly test him for the existence of a condition. He showed all the major signs and risk factors of pulmonary embolism, but he was sent home. He returns to the hospital, substantial pain, difficulty breathing, vomiting a tar-like substance. He suffered a blood clot in his lungs, and he suffocated to death. $6 million medical malpractice jury award. Another case, however, that didn't have to happen. Yes, big jury award, but simple. Didn't have to happen. Misdiagnosis, not proper test by the physician. These are what medical malpractice attorneys see. We see it commonly, and don't believe for a second that this doesn't occur, and doesn't occur quite frequently.
This is crazy. This is crazy. This is crazy.